Right. I think in this case, these examples that we were watching, a lot of them were the patient kind of sitting back and being more passive than being more involved in her own care. I think that's a great way to kind of summarize all of it. She was, assertive is one word. I think the word of being involved, or in the research literature, people talk about patient activation as an important kind of way to think about it as well. So yeah, really being involved and being assertive is a good way to think about kind of an umbrella for all of these different skills. Thanks. Right. So the question is really, how can we get our healthcare providers to talk with us about some of the psychological issues that we might be going through? I think that's really an important point to raise. One of the, and it's certainly probably one of the biggest foci of our training program, is helping doctors, especially young doctors, I think, to feel comfortable talking about some of those things. They may not have had the training or may not have had good examples in how to talk about those things. So it's one of the things that we focus on a lot. But as far as what we can do as patients, I think certainly trying to do some of these things. It sounds like you did some of them, and trying to express concerns and things about that. One suggestion may be that if you've done some research on your own, perhaps, and you know that cancer patients often get psychological support from a counseling center or for support groups, bringing that up specifically, asking the doctor for recommendations. Sometimes I've met quite a few doctors, not a lot, but a few, who really don't see that as their job to have that part of the discussion. And they may be much more happy to refer you to somebody who it is their job, who wants to have that discussion with you. And in the end, that might be better all around. Not all the time. I think it really depends on the clinician. Yeah, that's a good question. So just to repeat, so the question is if doctors sometimes may not bring up all the possible things that could happen because they worry that if they say that, then the patient will think it's going to happen, and then it will happen. I'm not sure I can speak for all doctors and why they do that or don't do that. From working with them in these kinds of communication training sessions, though, I've heard that as a reason of why they may not want to bring up something. Certainly also I hear doctors talk about how they want to give patients hope. They really, I think, the majority of doctors that I've met who work in this area in cancer really do care a lot about their patients, and they want to see them do well, and they want them to not feel anxious. And so they may kind of take a bit of a paternalistic approach in thinking that, I don't want to worry the patient too much by mentioning all these things. So yeah, I think there can be a lot of reasons why those might not come up. I think as patients, we may want to ask some specific questions about, what may happen. If you've had an experience before where you feel like you haven't gotten all the information ahead of time of what might happen, it may inform you in the future to ask those kinds of specific questions. But I think you raise a really good point there. So the question being, how aggressive or how assertive are we if we feel like we're trying some of these things and we're not getting anywhere with the doctor? How assertive do you want to be? Yeah, I think that's a really great question. One of the interesting research findings I've had in my internet work is that we've shown that patients who are very assertive with their doctors, like they go in and they say, I read this on the internet, or I want to get this prescription, they are more likely to get what they want than patients who are less assertive. However, I think that comes at some cost, because we've also shown that patients who are less assertive are more likely to report a better relationship with their doctor. So if we think about this doctor-patient relationship as really as a relationship and kind of a there's risks, there's benefits and risks to everything we do, right? It's really a judgment that I think everybody has to make individually in terms of how far to push it. If it's a surgeon that you're seeing, for a first time and you're planning to go get a couple of more opinions and you're just kind of checking things out, you may feel like it's okay to push it and see what happens. If it's a surgeon that you've already decided that you want to go to because this surgeon is the best at the surgery, you may feel like, understandably, that you don't want to push it as much. So I'm not sure if there's any great kind of black and white answer to that, but I certainly think that we kind of have to weigh those things in our minds. Okay, so the comment is that in her experience that she felt like she had to find a physician that she felt really comfortable with a personality style like hers. And yeah, I think that's absolutely very important. You want to make sure you have clinicians that you feel like you can trust. What that reminds me of, and kind of ties back to your comment though, is one thing that I have learned in working with doctors is that they have very different preferences around this very issue that you raise. I've met some doctors who are perfectly happy to sit there and let the patient ask them questions, and they just answer the questions, and they're kind of, I guess, checking off on their list in their mind that they've talked about everything they want to talk about. And I've met other doctors who that just scares them to death, that they're going to let the patient start asking questions, because what if they don't remember to go through everything? So, and I think that those are kind of different styles of communicating. And so in those cases, what I say to the doctors is that, if you really aren't comfortable just kind of turning over the control to the patient and letting them ask all these questions, like at the very beginning of a consultation, that they can say to the patient, it would be helpful to me if I could make sure I can tell you a few things first. I may answer some of your questions along the way, and then I'll leave time at the end to make sure we talk about that. Now, from the patient side, I was just thinking what we could do as patients then is, if we go in with a list of questions, is to say to the doctor up front, kind of in this agenda setting way, I've got this list of questions that I want to make sure we cover. I know, different doctors like to do this differently. What would you prefer, that I ask you these first or that I wait till the end? And so you kind of give that control over to the doctor, and not really give the control over, but give the doctor kind of that choice so you can find a comfortable way to manage the consultation. Yeah, well, so to that question, yeah, I think that these skills that we've talked about today, even though I talked about them in the cancer kind of active treatment context, I think that these are skills that can help us in any type of healthcare consultation. I mean, they actually initially were kind of developed and studied in primary care, not even in cancer. So I think these skills are absolutely transferable to survivorship care. To be perfectly honest with you, I'm not aware of anybody who's done any studies in this area. There's not a lot of studies in doctor-patient communication and survivorship. I think as more funding is going through to survivorship areas and a lot more attention is being paid to it from a research perspective, I think that'll change over the years. But right now, really, most of this work in doctor-patient communication has been done more in kind of the active treatment. I certainly think that, one of the things that I've heard from patients and that I know is a problem is this issue of, you may go to visit with your doctor for the last time for a while, and the doctor thinks and the nurse thinks, oh, this is great, you're done, and you're thinking, oh my gosh, I'm done. Who's going to be watching over me now? Who's going to be taking care of me now? One of the things that we're trying to implement actually is a communication training workshop to help clinicians with that last visit, to do it in a way where it's a longer visit. It would really be a kind of systematic change, but it's a longer visit, and there's more time spent talking through what the plan is, what the next steps are, and trying to reduce patients' anxiety. But certainly, I think as patients, we can ask those kinds of questions and express those concerns as well, because it's not going to, there's certainly valid concerns to have. Okay, two good questions. So one is, what do you do if you're getting conflicting information from two different doctors? And then second, what do you do if you're not sure which doctor to go to? So with the first one, I would absolutely say to just be very explicit about what your concern is. I had this experience myself where I had two doctors telling me two completely different things. And so I sat down with one of the doctors and I said, look, I'm really frustrated. You know, you keep telling me to do this and you keep referring me to this other doctor who keeps telling me to do something else. I said, I don't remember exactly what I said, but something like that. I'm really frustrated and I don't know what to do. And the doctor actually, I was surprised at, I think it kind of took him by surprise. I don't think he's had experiences where patients are really like explicit like that before with him about their concerns, and I did it in a nice way, but then we were able to negotiate a plan that was much better and I wasn't getting bounced back and forth. So that would be my first suggestion, is to just express express that you're confused or you're not sure what to do because you're getting these two pieces of conflicting information. If in fact it's a case where you're getting different opinions from people, you're trying to decide on a treatment and you have 2 or 3 people who are giving you different treatment options, which certainly happens, at some point, it's not that case, but if it were, I mean, at some point you may have to make a decision based on your own values and preferences and who you feel comfortable with about what you're going to do. To your second question, I think, a couple of things. One is that I think, as the woman in the back said, people develop different relationships with different of their care providers. And so one patient may have a really good relationship with her surgeon and kind of always go to her surgeon for issues, maybe not so much the medical oncologist. I think some of those issues, may just be who you feel the most comfortable with. The other thing to do is just to, again, be explicit to say, I'm not really sure if I should be coming to you or to, Dr. So-and-so with this, but here's my concern. And I think that, most doctors, nearly all doctors, will appreciate just, you being very honest about your not being sure about what to do. Right. So the question is, how do you decide when to communicate symptoms if it's in between visits? How do you decide who to communicate them to or if to communicate them to? I'm not sure, again, that there's really any black and white answer for that, except to say that I think that's a discussion that you should have with your primary clinician. And again, to be able to say that kind of explicitly, that ahead of time, to say, if I have symptoms, if I have concerns over the next 3 months or 6 months, what will be the best way for us to handle this? Again, using that kind of collaborative language, and trying to kind of problem solve it with that clinician. If it's a case where you feel like your clinician isn't taking those concerns seriously, or you're not feeling like you're getting the kind of support you need, then you may need to consider what you want to do next. But I think if you can kind of have that conversation sooner, kind of about what to do in the future, if those happen, I think that could be very helpful.
Okay, well, join me in thanking Dr. Weiland for a great talk. Thank you so much.